again. I'm Bridget. And I'm the hepatitis nurse at Auckland Hospital, and I'm going to talk about Maviret in the real world. So there is a little bit of repetition here. So Maviret, it's a direct-acting antiviral medication which we use to treat hepatitis C. It's a combination tablet of Maviret and Maviret Faire, and it's combined into a film-coated tablet. And you need to take 3 tablets once a day at the same time every day with food. And it's suitable for all genotypes, but as Ed said, we're not even going to be worrying about genotypes in the future. So Maviret is not suitable for people with Charles Pugh B or C cirrhosis. Those people will need to still be treated with Harvoni and ribavirin, which we can apply for through Pharmac, but we would be doing that at the hospital in any case. It is suitable for people with well-compensated cirrhosis, but they need 12 weeks of treatment. And once again, we would probably treat those patients at the hospital as well, because we would want to engage them in ongoing screening for hepatocellular carcinoma screening. Genotype 3, anyone who's had previous treatment needs 16 weeks of treatment, but everybody else only needs 8 weeks. And that's going to give them close to 100% chance of cure if they have the full course of the treatment. Before you treat someone for hepatitis C, though, we do want them still to have a fibro scan, and there was a question in the audience about that and whether that's going to delay things, and it really will not, because there's a really short waiting time to get a fibro scan at the hospital. So you can do an e-referral, and we should be able to do the fibro scan within a couple of weeks of receiving the referral. There is really no waiting time at all. But we also have some clinics in the community which are drop-in, which people can also go for a fibro scan, and they won't need an appointment for those. So there is a clinic every Wednesday at 1:30 at Pittman House, which my colleague Victoria Oliver, she runs the clinic there each week. We're also at the Needle Exchange twice a week. There's also a clinic run through the Quarter Centre, and that's a drop-in clinic for people that aren't necessarily Quarter Centre patients too. So if someone just wants to come along there and get a fibro scan, they can come in at no cost. There's also recently another clinic being set up through CADS at Kingsland, and that's taking place once a month at the moment, every Thursday at the last Thursday of the week. And Victoria and I are trying to get out there to the community and talk to people who are at risk, so currently people in rehabilitation and things, just to let them know about this, what's available out there in the community. I also take a picture of me with my portable fibro scan. I take the fibro scan to prison, and I think this treatment is really ideal for people that, because it's short, we can hopefully treat more people while they're incarcerated or inpatients or in acute mental health facilities and things. So we would want to take sort of opportunities to try and treat people who might be at risk for stopping their treatment when they're in a secure sort of environment. So there's been a little bit of talk about the previous treatment, and this sort of demonstrates the old bad days of pegylated interferon, where you had a weekly injection plus twice a day ribavirin, not to mention your antidepressant and your Panadol that you had to take, and all the lotions and potions because your skin was falling off and everything. And it was really pretty hard going for people. It's not going to be in French. I probably illegally downloaded this from the internet, but it had the right spelling of Maviret. So it's a once a day medication. So you take your 3 tablets at once, and it will come in a weekly box and given 4 weeks at a time. So at the moment they will have to come back in and get their repeat prescription. So we've had some experience using Maviret really through a clinical trial called the SMART-C study. And we've enrolled 40 people. We've been lucky enough actually to be able to enrol 40 people in the Auckland area. Most of those have been at Auckland Hospital, but we did have a couple of people that were treated through the Quarter Centre as well. And what the Smart C study was, it's a phase 3B open label multi-centre international randomised control trial of simplified treatment, because that's what we think is probably needed for those in the community, versus standard treatment monitoring for 8 weeks of Glucapavir and Bridget Faire and chronic hepatitis C treatment naive patients who were not cirrhotic, so they were all only going to get 8 weeks of treatment. So they were divided into, randomised into 2 arms, the standard monitoring arm, and we had 23 patients enrolled in that. So they came in for initial clinical review and blood tests. They were started on treatment. We gave them 4 weeks worth of treatment, and we saw them once a month. So we'd see them in clinic at 4 weeks and at the end of treatment, and give them the remainder of the treatment and have blood tests. So all of those patients, their liver tests had all normalised by 4 weeks into treatment, and they all had a Hep C viral load done at the end of the treatment, and it was negative in everybody. So we kind of think, you know, we're seeing normal results, so do we really need to do them? In the simplified monitoring arm, we had 17 patients, and they once again came in at the beginning for the clinical review at the start of the treatment, but they were given the whole 8 weeks at once. And then we just gave them a phone call at week 4 and 8 just to really monitor compliance and advise if they had any side effects and or any questions or concerns. There were 2 people that dropped out of the study, but both have actually subsequently completed the treatment. One was returned to jail, and the other person just decided he wanted to defer treatment, so we had to stop him, drop him from the trial. In terms of side effects, it's really well tolerated. So one of the bits of information that we were collecting was, you know, whether they had any side effects. And I guess headache, fatigue and nausea was probably the most commonly reported. But for most people it was just reported as mild, sometimes moderate. And in most people, certainly by the end of treatment, they were actually feeling better and not complaining of any side effects at all. So it was really remarkably simple to use. The simplified monitoring arm, we didn't see them back until 12 weeks after they'd completed the treatment, when we repeated the Hep C viral load to see if they were cured. So far we've seen 24 out of 40 which are cured. We've had no treatment failures. We've still got 16 who are just waiting on their SVR12 Hep C viral load results. And the patients love it, basically. It's so easy. So I just wanted to present a couple of case studies. The first one is a 46-year-old male. He has genotype 3. He does have cirrhosis, but well compensated. He'd been a previous responder relapser to pegylated interferon and ribavirin, and he also had renal impairment, so we were able to get this through the compassionate supply. So we gave him 16 weeks of Maviret because he's genotype 3 and he'd had previous treatment. He tolerated the treatment well, and he's been cured, and there's really not that much else that we can say about him. The next case is a 71-year-old male who we treated through the Smart C study. He's genotype 3A. He had moderate fibrosis. He'd never had treatment before, so he met criteria to get into the study. He did have peripheral vascular disease, and he was on quite a number of different medications, as I've listed here. And there were a couple of issues with some of the medications. So we recommend, if you want to look for any potential drug-to-drug interactions, that you use this website here. And I just did a little input for the medications that this person was on, and it prints you off a really nice kind of summary. So we've got the list of all the ones which there's no problems with, and then it outlines to you if there is a potential drug-to-drug interaction, what it is and what you need to do. So he was on atorvastatin, so we did stop that throughout the treatment, but we just stopped it at the day that he started the treatment, and he recommenced it once again when he'd finished the treatment. The dabigatran, we did have to reduce the dose, but once again we just did that at the start of the treatment and increased him back to his pre-treatment dose once he finished the treatment. So for him, we reduced his dabigatran, we stopped the atorvastatin. He didn't need to have any other of his medications changed. He had his 8 weeks treatment course. He tolerated it really well, and he was cured as well. So for the future, we really want to be part of the World Health Organisation target for Hep C eradication as a public threat by 2030. So we're looking more and more to community-based testing and treatment. So there are all sorts of new and exciting things coming, such as the rapid testing, which hopefully we'll be able to do in the community. And there is a study which is going to be out, which is going to be looking at this. So people will be able to come in, have a blood test, wait an hour for their results, and if they're positive, get a prescription for their hepatitis C treatment and get on and started treatment. So really we want easy, accessible treatment for all. So just to sort of recap who should be treated, well, we do kind of do targeted testing, but we kind of open it up so people can just have any one of these reasons here. They don't necessarily need to identify why they're having a hepatitis C test. If they want one, they should be able to have one. And so we've sort of come up with if you're feeling old and tired, then maybe you should get tested. It might be something that you can fix. So in summary, Maviret's really simple to use. It's really well tolerated. Most people only will need 8 weeks of treatment. Results are excellent. There's very few drug-to-drug interactions. We really don't think that there's any blood monitoring that's required for the type of people that you're going to be treating out in the community. The only people would be perhaps if they were cirrhotic, but we will treat them at the hospital. But we need to find the undiagnosed.